Have you ever walked into a room and forgotten why you were there, or struggled to remember a conversation from just yesterday? Most of us assume these moments are simply part of getting older. But what if your brain is trying to tell you something more important? The truth is that the brain often sends quiet warning signs long before serious problems become obvious. Many people ignore these early clues because they seem small or harmless. Today, we'll look at 7 silent brain warning signs that adults over 60 should never ignore. Some are easy to miss, and one of the final signs surprises even doctors because it often appears before major memory problems. Let's get started. As we age, it's normal for our brains to slow down a little, but normal aging should not stop you from enjoying daily life or managing familiar tasks. Some changes may point to health conditions that can be treated, while others deserve a closer look before they become more serious. Paying attention to these signs doesn't mean expecting the worst. It means giving yourself the best chance to protect your brain and stay independent. The first warning sign is forgetting recent events more often than usual. Everyone forgets a name or misplaces their glasses once in a while. That's completely normal. But it becomes more concerning if you often forget conversations, appointments, or something that happened just a day or two ago. For example, imagine your daughter visits for lunch, but the next morning you have no memory of seeing her. That is different from simply forgetting where you left your keys. Several things can affect recent memory, including poor sleep, certain medications, dehydration, vitamin deficiencies, or depression. In some cases, it may also be an early sign of a condition affecting the brain. If these memory problems are becoming more frequent or your family has started noticing them too, it's worth mentioning them to your healthcare provider. Staying physically active, getting quality sleep, and keeping your blood pressure under control are all habits that support long-term brain health. Another common sign is having trouble finding the right words. Have you ever known exactly what you wanted to say, but couldn't think of the word? Occasional pauses happen to everyone, but if it becomes a regular part of conversations, your brain may be working harder than it used to. You might point at a television and call it "that box," or stop speaking because a simple word disappears from your mind. This can happen because the brain areas responsible for language are not working as efficiently. Stress and tiredness can also play a role, so one bad day isn't a reason to panic. Still, if family members begin noticing these changes, don't ignore them. Keeping your mind active may help maintain language skills. Reading, doing crossword puzzles, learning a new hobby, or simply having regular conversations with friends can all challenge the brain in healthy ways. And don't stop watching, because the next warning sign is one that many people mistake for normal aging when it often deserves much more attention. The third warning sign is struggling with everyday tasks that used to feel easy. Perhaps you followed the same recipe for years, but suddenly can't remember the next step. Maybe paying bills, organizing medications, or using familiar household appliances feels confusing. These changes may seem small at first, but they can signal that the brain is having trouble with planning and problem solving. There are many possible reasons for this: a vitamin deficiency, thyroid problems, medication side effects, or poor sleep can all affect thinking. That's why it's important not to jump to conclusions. Instead, pay attention to patterns. If simple tasks consistently become more difficult, bring it up during your next medical visit. One helpful habit is to keep challenging your brain with new activities. Try learning a simple card game, cooking a different recipe, or taking a new walking route. Small mental challenges encourage the brain to stay active and engaged. The fourth warning sign is a noticeable change in mood or personality. This often surprises families because it doesn't seem connected to the brain. A person who has always been calm may suddenly become unusually irritable, anxious, or withdrawn. Others may lose interest in hobbies they once loved or stop enjoying time with friends. Mood changes can happen for many reasons. Loneliness, grief, chronic pain, and depression are all common in older adults and deserve attention. But when emotional changes appear alongside memory or thinking problems, they shouldn't be dismissed as simply getting older. One of the best ways to support both emotional and brain health is to stay socially connected. A phone call with a friend, joining a community group, or spending time with grandchildren keeps both the mind and emotions active. And coming up next is a warning sign that often begins with the way you walk. Many people never realize their feet can reveal important clues about what's happening inside their brain. The fifth warning sign is a noticeable change in the way you walk or keep your balance. It's natural to slow down a little with age, but you shouldn't suddenly feel unsteady for no clear reason. Maybe your steps have become shorter, you shuffle your feet more often, or you find yourself reaching for furniture while walking through your home. These changes can increase the risk of falls, but they may also reflect changes in the brain. Walking is more complex than most people realize. Your brain must constantly communicate with your eyes, inner ear, muscles, and nerves to keep you steady. If any part of that system isn't working well, your balance can suffer. Arthritis, vision problems, diabetes, certain medications, and inner ear conditions can all affect walking, so it's important not to assume the cause. Regular exercise that improves strength and balance, wearing supportive shoes, and keeping your home free of tripping hazards are simple steps that can help. If you notice repeated falls or a clear change in your walking pattern, talk with your healthcare provider. The sixth warning sign is becoming confused about time or familiar places. Forgetting what day it is once in a while is common, especially after retirement. But regularly getting lost in a neighborhood you've known for years or forgetting how you arrived somewhere deserves attention. Imagine driving to your favorite grocery store and suddenly feeling unsure which road to take. That can be unsettling and shouldn't be ignored. Sometimes confusion is caused by treatable problems such as dehydration, infections, low blood sugar, or medication side effects. In other cases, it may point to changes affecting the brain. Keeping a daily routine, using a calendar, and setting reminders can make life easier, but they shouldn't replace a medical evaluation if confusion becomes frequent. And remember, if confusion appears suddenly along with weakness, trouble speaking, or changes in vision, seek emergency medical care right away because these could be signs of a stroke. The seventh and final warning sign is poor judgment or unusual decision-making. This doesn't mean making one bad choice. Instead, it's a pattern of decisions that seem very different from the person's normal behavior. For example, someone who has always managed money carefully may suddenly trust phone scammers or make risky financial decisions. Others may repeatedly leave the stove on, forget to lock the front door, or dress for freezing weather in light clothing without realizing it. Good judgment depends on healthy brain function, but it can also be affected by poor sleep, depression, medication side effects, alcohol, or other medical conditions. That's why it's important to look at the whole picture rather than assuming the worst. If family members notice these changes, take their concerns seriously. An early medical evaluation can help identify causes that may be treatable and provide guidance if additional care is needed. Let's quickly review the 7 silent warning signs we've covered today. Forgetting recent events, frequent trouble finding words, struggling with familiar tasks, changes in mood or personality, new balance or walking problems, confusion about time or familiar places, and poor judgment. Having one of these signs doesn't automatically mean you have a serious brain disease. Many health conditions can affect memory and thinking, and some are completely reversible. The important message is to pay attention to persistent changes instead of brushing them off as normal aging. Your brain works every moment of every day, and the choices you make can support its health. Stay physically active, eat a balanced diet, keep your blood pressure and blood sugar under control, get enough sleep, challenge your mind with new activities, and stay connected with family and friends. These habits may not prevent every problem, but they can help support healthy aging and improve your quality of life. Before you go, we'd love to hear from you. Which of these 7 warning signs surprised you the most? Share your age and the country you're watching from in the comments below. Your experience could encourage someone else to take an important step toward better brain health. If you found this video helpful, don't forget to like and subscribe so you never miss future videos on healthy aging. Thanks for watching, and we'll see you in the next one.